All right. So if you're here, you must have come from the LivStrong Classic comparison video. So now we are going ahead with discussing LivStrong Diabetes. We're comparing it to Nutren Diabetes, Glucobest, Glucerna, and Diabetasol. They're also made by the same manufacturers. The same manufacturers to the ones we were comparing to LivStrong Classic earlier. So general information, additional components, because this is a specialized product for diabetes. And then again, macronutrients, vitamins, and minerals. So this one will be a faster video compared to earlier because we already discussed the sections. All right, so we have Nutren Diabetes by Nestle. So currently it's Nutren Diabro. And then we have Glucobest by Unilab. NutriBest is its counterpart. Glucerna by Abbott. So earlier Ensure was its counterpart. And then we have Diabetasol. Entrosol is its counterpart. So those are counterparts for the basic for healthy people variant of the products. Okay. And then Livestrong Diabetes. So Livestrong Diabetes Vanilla is balanced and complete nutritional meal replacement designed for Asians. It's formulated with glycemia management factors, including high absorption chromium and white kidney bean extract to help with managing diabetes and metabolic syndrome. It is suitable for use pre and post surgery, high protein diet, supplement for elderly, liquid diet, lactose intolerance, tube feeding diet, and for vegetarian diets. So the same as Livestrong Classic, 2 servings can provide your daily micronutrient needs, and 6 servings can provide 1,500 calories, and it's clinically tested to sustain patients for long periods of time. So if you still remember the caloric distribution earlier, this one has even lower carbohydrate percentage, higher protein percentage. So earlier it's 16, now it's 19.7. And then for fat, it's 37.4. So the same protein protein complex. So 50% whey, 50% soy, canola oil, maltodextrin. Also still an isotonic formula. All right. So for Livestrong Diabetes, the serving size is 55 grams. That's the same with Nutren, Diapro, Glucobest 52 grams, Glucerna 52 grams, Diabetasol 60 grams. The calories per serving for Livestrong Diabetes is 251. For other products, 253, 229, 228, 258. And the macro percentages. So C for Livestrong Diabetes, it's 43, 20, 37. Nutren Diet Pro, 43, 18, 39. So it's not too different. So for Glucobest, it's 49, 18, 33. So that's still a higher carb percentage. Just like Glucerna, it's still a higher carb percentage, just for 47, 18, 35. Now with Diabetasol, as discussed earlier, 60, 15, 25 is the standard, uh, is the average macro split for adult intake per day. However, we're talking about diabetic patients here. So they could have done with uh a lower carbohydrate percentage. So this is just a start, but you will see that Diabetasol, just like Entrosol, will fail many marks here in this comparison. Okay, osmolality, tips from diabetes is 300, Nutren Diapro is 250, Glucobest 270, Glucerna 354, and Diabetasol 400. So you can see that because the carbohydrate is lower, carbohydrate amount is lower, that contributes to an improved osmolality. Because earlier in the other products being compared to Livestrong Classic, because of the higher carbohydrate, it's the osmolality is also higher. Okay, so macronutrients per 100 grams of formula. So for energy in calories, 457 for LivStrong Diabetes, and Nutren Dipro 460, 440, 437, 430. So Glucobest and Diabetasol give the least amount of calories per 100 grams. For total protein, so again, this has a higher protein amount compared to LivStrong Classic. It's 22.5 grams. Nutren 20.5, Glucobest 20, 19.5. Diabetasol gives the lowest amount of protein per 100 grams. And then for total fat, and so this is higher than compared to LivStrong Classic because lower carbs, higher fat. So 19, 20, 16.3, 16.7. Again, because it's the macro split is 60, 15, 25. The fat is on a lower range. So saturated fat in grams is 3.5, 1.8, 2, 1.9, and 2. So again, I mentioned that soy protein contributes saturated fat. Cholesterol, 0 for all except for Glucerna. That gives 8 milligrams of cholesterol. Total carbs, LivStrong Diabetes 52.8, 44.5, 57.8, 50, 65. See how high that is compared to the others. For dietary fiber, this is also higher for LivStrong Diabetes compared to the classic version. So 8.7, 13.2, 7.5, and 6. So again, I mentioned earlier that if the fiber content is higher and the client using it is sedentary, then the patient might encounter unwanted effects because you can't just add fiber. Parang you have to increase your fiber intake gradually. So if you're coming from no fiber intake to 13.2 grams of fiber intake per day, then that can cause some discomfort, GI discomfort. So sugars, 7.5 for LivStrong. For Nutren, 4.8. Glucobest, 9.4. 10.8. 11.8 for Diabetasol. Now, for diabetes-related inclusions, this includes taurine, so may help in diabetes by regulating blood sugar levels. So here you can get your copy of the slides in the link in the description. Okay. So there's carnitine, enhancing glucose utilization. There's inositol. There's choline. There's zinc, magnesium, and chromium. You see there are a lot of bullets under chromium because chromium is really the diabetes related supplement, mineral, or nutrient. All right. So see how diabetasol doesn't have any for taurine, carnitine, inositol, and choline. Now for taurine, LivStrong gives you 50 milligrams, Nutren 31, 40, 38, carnitine 50 milligrams, 38, 33, 33. You have inositol, LivStrong gives 50 grams, Nutren 0, Glucobest and Glucerna gives you a high amount of inositol. And then for choline, LivStrong gives 138. They have 170, 175, 191. And for zinc, LivStrong gives 5.2 milligrams, 3.5, 5.5, 5.8, 5.5. Magnesium, 138. So 84, 198, 114, 100. And then for chromium, LivStrong gives you the highest amount of chromium picolinate, which is the fast absorbing type of chromium. So 184 micrograms. For Nutren 44, Glucobest 150, Glucerna 76, and diabetasol doesn't even give you chromium, given that it is a diabetes specialized product. So for LivStrong Diabetes. These are 8 carbohydrate metabolism management factors that they have. So you have non-water soluble dietary fiber to promote GI peristalsis for easier bowel movement. You have water soluble dietary fiber. So it prolongs gastric emptying, meaning so again, what brings up satiety value is fat, protein, and fiber. So added fiber prolongs gastric emptying time, making you feel full for longer. So this is really important for people with diabetes because they would also usually be the ones who have uncontrolled cravings. So, but if a meal replacement such as this helps them feel full, then they might have um less times giving into their cravings. So it's low glycemic index, no addition of fructose or lactose. Then you have your white kidney bean extract, which helps delay starch absorption for greater stability in blood glucose levels. You have high absorption rate chromium to help reduce insulin resistance and normalize carb metabolism. It's a great source of zinc. So it provides 64% daily value for zinc for immunity and antioxidant action because we know that people with diabetes, their immune resistance can be compromised. And then it's a great source of magnesium. So it's 37% daily value for magnesium, which helps improve insulin release and sensitivity. All right, so we move on to vitamins, starting with fat-soluble vitamins. So again, the RDAs in dark ochre such as this are from PDRI, Philippine Dietary Intakes. And the faded yellow ones are international standards, just in case it's not available in the Philippine standards. So for vitamin A, Dietitian Diabetes gives 215. And then again, Nutren Diapro and Glucobest gives a lot of vitamin A. And because these are fat-soluble vitamins, we can store them. So we don't have to really have a high intake of this every day. Okay. So for vitamin D, 3.7, 6.2, 4.9. Glucerna gives you 12.5 and Diabetasol 1.38. You have vitamin E, 5.5, 4.8, 8.5, 10.1. So Glucerna, just like Ensure, also high in vitamin E. Oh, I forgot to encircle this one. So for vitamin K, 44.1, 37, 30, 38. No vitamin K for diabetasol, just like with Entrazol. And then you have water-soluble vitamins. So B1, 0.5, 0.6, 0.8, 0.4. See, for vitamin B2. So for these, there are no marks. They are good for the B complex vitamins. For vitamin C, still good. Okay, so again, no choline for diabetasol. For minerals, so for sodium, 425, 430, 400, 405.T. All good, except for calcium. For calcium, Glucobest gives you the highest amount of calcium. So if someone has advanced kidney disease, you can't really give them something that is very mineral heavy, wherein there's a lot of calcium, phosphorus, magnesium in just one serving of that food. So this is a little bit high for 28. And phosphorus, the standard is 700. Livestrong gives 259, 250, 265, 323, 200. For magnesium, still good. So now I'm just gonna point out the things that I marked. So for copper, wherein 900 micrograms is the standard per day. Nutren gives 550. Nutren is also a high amount, so 650. Glucobest gives you 880 micrograms. So to recap, the function of copper is to recycle iron so that when the red blood cells die, they the iron is recycled into new uh red blood cells. It says high. Okay. So for manganese, 1,300 and 1,800. Here are the amounts. So for diabetasol, again, 0 copper, 0 manganese, which is an important trace mineral for normal metabolism. And for iodine, you have 150 micrograms standard, 47, 54, 65, 70, and 42. And then for your trace minerals, selenium, chromium, and molybdenum, diabetasol is not serving you that. So really, the products from Calbee International, both diabetasol and entresol, are not really good. And then we've spoken with doctors, and what is close to the quality of LivStrong Classic and Diabetes are the Unilab products, which are Glucobest and NutriBest. And then again, Glucerna, and especially Ensure, what they do is to really give you a lot, to literally ensure. But these are our bodies. We can't just give people the maximum for some nutrients and pray that, oh, all right, you'll be healed because of these. So, all right. So thank you for listening. Again, you can check the link in the description to download our FDA certificate, to download the copy of these slides, as well as the soft copies of our brochures. So you will have access to our different materials. And if you go back to that link, it will be updated from time to time as well. So thank you for listening and have a great day.